Hello, I'm Dr. Larry Perich. Welcome to the Perich Eye Center. We've been located on Seven Springs Boulevard in Newport Richey since 1991. I'm a graduate of the University of Southern California and medical training at the Chicago College of Medicine and a residency completed at the Metropolitan Hospital in Grand Rapids, Michigan. I'm a board-certified ophthalmic surgeon.
Dr. Perich has been in practice here in Newport Richey since 1983. Through the years, his practice has developed from a typical ophthalmology office to a more sophisticated setting, specializing in cataracts, laser, cosmetic, and LASIK surgeries. Dr. Perich has performed over 28,000 cataract surgeries using the latest techniques. As a refractive surgeon with an extensive background in laser vision correction, he can also provide the use of laser surgery to eliminate the need for glasses after cataract surgery. LASIK surgery is another ophthalmic procedure offered at the Perich Eye Center. He was able to perfect this technology to be chosen by the airline industry as the surgeon of choice for the National Air Traffic Controllers of the United States. As the patient base becomes older, more and more patients are requesting eyelid surgery or laser blepharoplasty to remove excess, puffy, or lax skin that makes them look more tired or older. Blepharoplasty is performed as an outpatient procedure using local anesthesia here at our Seven Springs Surgery Center or in the Tampa Bay Surgery Center. In addition to blepharoplasty, Dr. Perich does many other cosmetic procedures. Laser skin resurfacing with the CO2 laser, ultrapulse laser skin resurfacing, erbium laser for the treatment of aging or sun-damaged skin, brow lifts with and without implants. They carry a complete line of Obagi products and even use the blue peel to remove blemishes, acne scars, wrinkles, uneven pigmentation, and sun damage. The most common request is for Botox treatments. Botox is used to improve the appearance of worry lines, frown lines, laugh lines, crow's feet, and other major dynamic wrinkles in the face. Since this is Florida, Dr. Perich sees many patients with allergy symptoms ranging from itchy eyes, red eyes, swelling of the eyelids, tearing or watering eyes, or a chronic feeling of something in my eye. While drops occasionally work and are a first-line treatment, he finds that inserting punctal plugs into the ducts is the best long-term treatment for the happiness of the patient. Complete eye exams and additional testing is not only essential, but necessary in diagnosing and treating many eye diseases. Macular degeneration is an eye disease that affects the central vision and is the most common cause of vision loss among older people. Glaucoma is a disease that causes damage to the optic nerve, often without symptoms or early warning signs. With the proper diagnosis, medical care, and continued monitoring, glaucoma can be treated and controlled. Here at the Perich Eye Center, they have the latest equipment in the Heidelberg Retina Topograph 2, which measures the size, depth, and shape of your optic nerve on the initial visit and monitors it on regular intervals to determine changes from your last visit. They also use other valuable equipment such as visual field analyzers. For most ophthalmic laser and cosmetic procedures, Dr. Perich uses the Surgery Center at 2024 Seven Springs Boulevard in Newport Richey. They have a very highly skilled staff of nurses and anesthetists who are very compassionate and understanding of the mental and physical trauma of surgery. The patient's comfort is always the priority of the staff. The other valuable attribute that they're proud of is that the patient comes in, gets the procedure done, and is home without being gone all day.
In this short presentation, I've given you the highlights of my practice. The Perich Eye Center and Seven Springs Surgery Center. I'm available to individual doctors, group of doctors, and/or groups of patients to give talks or seminars on any or all the procedures I perform. The patients with cataracts, they hope to have still the vision of reading close and distance.
Well, the golfers I found are particularly happy having had this surgery because they can see the ball in the distance and then they can mark their card.
Exactly.
So they've been very happy, the people that play golf that have had the Crystalens implanted. Well, I've had the pleasure today of being in surgery with Dr. Perich at the Seven Springs Surgery Center. And I have to say, it's been a fantastic experience. Dr. Perich is a superb surgeon. The facility here is wonderful with all the latest equipment, and the staff are very, very friendly. So I've had a very excellent day with these first 6 patients we've done today.
Vision restoration center is possible as long as 20 days for a minimum of 10 minutes a session. You will committed the culinary muscle to controls a combination and has been dominant, but then the lack of use in goods to get back into shape.
What about this line here?
Your distance and intermediate version are good and your heart is improving. You keep up the good work and keep repeating with glasses. You're on your way. Everyone's unique and your optimal vision will be different.
What about here?
From,
We're really pushing you now.
great job. You have, you had work, wait, great job. You had work has paid off, or your hard work has paid off, and you are now seeing new things.
That's pretty good.
Most of the art, most of the time without glasses, keeping the glasses in front of the reader, you want the restoration center at least twice a day.
That's
Based
the
on
stock,
the same
that's the
numbers.
stock quote in the New York Stock Exchange. Read the sign on the wall there.
No smoking.
What's underneath it to the right?
Housekeeping.
I'm Stuart Cumming. I'm an ophthalmologist and I'm the developer of the Crystalens. And I've been in surgery today with Dr. Larry Perich at the Seven Springs Surgery Center. We've had a great day. Dr. Perich is a superb surgeon, and we've done the first 6 cases here, which all had patients with cataracts. And many of these patients within an hour of surgery are seeing very well. Wouldn't you agree, Larry?
Yeah, today has been a wonderful experience because I've been operating for 20 years doing cataract surgery, and usually after cataract operations, our patients can see better, but today our patients were actually able to see well across the room 1 hour from surgery and also read stock print within 1 hour of the operation. So we've had a beautiful experience. The patients were so elated about their operation and the fact that they could read and see across the whole operating room area 1 hour after surgery that it brought tears to our patients' eyes, and big hug and kisses for Dr. Cummings. Your implant, I feel, will definitely give them a good computer vision in addition to the distance.
Well, it's all automatic. You know, it's just like when you're 30 years old or around that age, where the brain tells you where you want to see, and automatically, without thinking, it focuses exactly where you want to focus. And that's the way the lens works. So it'll focus seamlessly from distance up near.
I think it's a great product.
Thank you very much.
You're welcome.
Thank you. It's been a pleasure to be here with you today.
Okay, my pleasure.
Hi, I'm Florence Henderson. When I recently needed cataract surgery, I chose Crystalens, and I can't tell you how thrilled I am with the results. Talk to your doctor about whether you're a candidate for Crystalens.
1-800-972-5367.
How you doing? Oh, I'm just glad you're happy.
Yes, I can see. Thank you so much.
Oh,
I'm
it's not me.
overwhelmed.
You've got a fantastic surgeon in there and a whole staff here to thank too, you know.
Oh, yeah. Thank you, everybody.
Yeah. You got one of the best here.
I know. I can see that clock.
Yeah.
Speaking of,
Thank you. I can see.
I can see you.
Surgery, you know, it's not only what goes on in the operating room that's important, and of course Dr. Perich is a superb surgeon, but it's the team that he's working with. And he has a superbly trained team, and this is important because the lens that goes inside your eye is like a spectacle lens. You've got to get the right power in there in order to be able to see at the distance and everything in between. So having the team is just as important as having a good surgeon, and we've got an excellent surgeon who's trained an excellent team here.
I'm 49 years old. I have been blind all my life since 2nd grade, wearing Coke bottle glasses. And I went to go get LASIK surgery last year, and they told me that my corneas were too weak, I couldn't get it done, and that that was just it. And then I came to see Dr. Perich for a second chance. Maybe I thought the other guy made a mistake, and he said no, but I could try this new Crystalens because I had a cataract started. So I came, and I was not scared. I was excited, and now for the first time in 49 years, I can see. After just coming out of that room 15 minutes ago.
Today, I went into surgery with Dr. Perich, and we did surgery on 6 patients who had cataracts. And immediately, within 1 hour, these patients were absolutely delighted with their vision. They're seeing many of them up close so they can read the newspaper, and they're also able to see across the room. And these patients were so happy that they were giving Dr. Perich hugs and kisses. It was a very, very rewarding experience for me since I spent the last 15 years developing this lens.